Okay, welcome back to the Brian for Liberty podcast. Thank you for tuning in today. I hope that everyone out there is staying safe and healthy. Today's topic, as we just talked about on the last episode, today we're going to be talking a little bit about healthcare and how we got here and all this conversation about Medicare for All, why that wouldn't work, and then talk about some potential solutions to what is going on with our healthcare and ways that we can work to fix it. Before we get started, we are going to, of course, we have to address coronavirus. It's the primary topic on many people's minds right now. And I guess from my perspective, again, I'm not an expert. I'm not a virologist. This isn't something I've studied. But I will say that as a libertarian, I view the cornerstone of libertarianism as personal responsibility followed by care for your fellow man. So I hope everybody is out there being responsible and making good decisions. If you are in a low risk group, I hope that you are still using social distancing and still following the instructions from World Health Organization and the CDC in terms of keeping the spread of this down. Please think of your parents, your grandparents, the elderly people in other lives, all the people out there who do have underlying conditions who can be very high risk when it comes to this particular illness, and just practice the guidelines, like I said, put forth by the CDC and the WHO. So that's all I've got on the coronavirus. We're not going to discuss it a lot on this podcast. I hope you're coming here, and if you're listening to this, you're looking to get away from it a little bit. And so we're going to talk about some other things. We have been talking a lot, or we've been hearing a lot through the election cycle about Medicare for All. That is obviously that's the Bernie Sanders movement. It's also big with the Elizabeth Warren campaign. It looks like Joe Biden is going to end up with the Democratic nomination. It's because of that, I think that Medicare for All at this point is going to take a little bit of a back seat, which is a good thing. Medicare for All is not a solution that would be actionable here in the United States. It just would not work. And we're going to talk about why that is. But with it taking a back seat temporarily, I think you have a lot of Bernie Sanders people who are very upset that Medicare for All is going to continue to be a thing that is pushed for in this country. And I think that younger people are going to continue to look at Bernie Sanders and the government and his movement to a more social democracy sort of setup. And by the way, it's a social democracy is what Bernie Sanders is. It's not democratic socialism. It's not socialism. It's a social democracy. He wants to model our economy after Scandinavian countries, and we'll talk about that as well. So when you hear me say social democracy, that's the proper term for what he is claiming that he is pushing for, which is a big social safety net funded through taxing private enterprise. So anyway, I think you're going to continue to get that push. I think you're going to have a lot of young people who still think this is going to be a good idea and that this is a solution. I think there's the same push there for paying off student loans and debt forgiveness and all these different things that the Democrats are essentially lining up and getting in, trying to knock each other down and seeing how quickly they can give stuff away. It's a bunch of fairy tales. It doesn't work in the real world. We're going to go over the medical side of it today. We're going to touch on where the federal government is and how it's very important that we stop asking them to do more things and start asking them to do less, start demanding that they do less, that we're in an untenable situation with our finances, with our national debt, that this is not a way that we can keep moving forward. So we're going to go over some of that. But today our focus is going to be on the medical side. And I think the first and most important thing to recognize is the fact that while I don't support a Medicare for All system, and I just absolutely don't believe a system like that would work here, that does not mean that I think that our current healthcare system is perfect and doesn't need to be changed. But we have to understand how we got to this system if we can understand how the flaws in our system evolved, how we got to this place where we do have 20 million, 20 to 30 million, depending on the count of people who are uninsured. And quite frankly, the coronavirus is going to bring this back into perspective in terms of a lot of people are probably going to end up losing employment. And so when your health insurance is tied to your employer, what happens is as unemployment increases, the burden on the state becomes higher. As people lose income, they fall onto the state Medicaid programs. Um, and they lose their employer sponsored health care. People with pre-existing conditions end up in a situation where they've lost their insurance, and now it's difficult for them to go out and get coverage and be able to sign up for programs where they can be protected from the pre-existing conditions that they had. So our system has some very, very fundamental flaws that need to be addressed. And the bottom line is that they're not going to be properly addressed through a Medicare for all system. And the reason for that is it's just not an affordable, it's not executable here. But we have to understand how we got here. So let's start there. And what we're really doing is we're living under the legacy of laws that were passed during the Great Depression. So to understand what was going on during the Great Depression and how this came to be is because we had such a drain on our labor force, and at the same time we were massively increasing production for the defense efforts, we had what was going to be out of control inflation. That was the government view of this, is that inflation was going to be out of control. And so Franklin Delano Roosevelt at the time decided to pass the Stabilization Act in 1942. And what this did was it froze prices, but it also froze wages. The problem with that was because the employment market was so competitive, it was becoming difficult for for employers, I should say, to attract labor. They weren't allowed to raise wages, so therefore it was becoming more and more difficult for them to attract workers. So what happened was when we talk about the freeze of wages, they excluded from that benefits. And so what they did was, since you couldn't pay more, but what you could do is offer health insurance, for example, or a retirement plan. And these things didn't count against the Stabilization Act. So employers started offering health insurance as part of a benefits package to attract workers. This was strengthened even more down the road as Congress began to mess with the tax code a little bit. If you think about how the payroll taxes work, right? You pay Social Security tax, and half of that tax you pay, half of it your employer pays. So for every dollar in wages you get paid, your employer is paying you about $1.10, let's just say, on average, because they're also paying the payroll tax against your salary. On the other side of that is the benefits were tax deductible. And so what that means is that the companies were able to offer these benefits and deduct those from their taxes. So instead of paying, it costs them about 80 cents on the dollar to provide you with a benefit when it costs them about $1.10 to pay you higher wages. So think about that in terms of, we hear about stagnant wages all the time. It's much more beneficial for them to have you collecting benefits than to pay you a higher salary, because it's less expensive for them to simply offer you more benefits. And by them, I mean, of course, employers. So some of these secondary policies that affected the tax code really kind of codified the fact that Americans were going to get their health insurance moving forward from their employer. And that's how we ended up in the system we are right now, which is primarily employer-sponsored health care. It's very important to keep in mind also that when we look at our health insurance issues here in the United States, the doom and gloom that's being spelled out isn't necessarily accurate. Now, it's doom and gloom for somebody who is uninsured and can't get insurance. It is doom and gloom for somebody who has a pre-existing condition and can't get coverage. I'm definitely not trying to minimize those things, but let's just keep in mind that about 90% of Americans have health insurance, and of that health insurance, about 80% of it, a little over 80% of that, is actually employee sponsored, employer sponsored health insurance. So most Americans are covered. The vast majority of Americans are covered. The vast majority of those covered are getting an employer sponsored plan that is an affordable plan that does offer comprehensive health coverage. So we have to stop pretending that we have this situation where massive amounts of our population aren't covered. And then if you are low income, there are safety nets state by state in the Medicaid system to help the people at the lower end of the income structure with their health insurance. So it's not that we don't have any social safety net in this country, and it's not that large portions of our population are going uninsured. So we have to make sure that we're having an honest conversation about this, because when we talk about Medicare for all, we're talking about we're going to force everybody into the country into a program okay, or force everybody in the country to pay for a program. We may allow, because there's two different versions of this plan out there, we may allow private insurance to continue to exist, but overall, we're going to force everybody to pay for this massive government program, really to solve a problem that's not as large as from a scale perspective as it's being made out to be. So like I said, we got to keep in mind that we have, over 90% of Americans have health insurance coverage. Over 80% of that coverage is employer sponsored. It is affordable and it does provide good coverage. So let's just keep that in mind as we have these discussions about health insurance. When we talk about the flaws in our current health system, there are some things that we need to address. One of the most interesting things here is that when the government intervenes into a market, it eliminates our ability to see what would have happened in a free market situation. So prior to all these acts during the Great Depression, most people paid for their health care directly. They paid their doctor directly. We all hear about the doctors who made house calls, the doctor who took, two chickens and a ham for coming by and doing a checkup, or you got sick and the doctor comes to your house and checks on you. We've all seen the old movies. The doctor with his black bag comes in and is taking care of you. One of the things that you'll hear a lot when it comes to consumers back then being able to directly pay for their health insurance versus modern medicine today is that modern medicine is so advanced that it would be unaffordable in a scenario where consumers were being made to pay for it directly. The health insurance is absolutely necessary because there's no way that the average American would be able to go in and pay for health care because it's so expensive. The problem with that is again, we don't know how healthcare would have evolved in this country in a free market situation, right? So you can't say that because we don't know what healthcare, how would this have evolved, right? Obviously, providers, people who provide healthcare, want business. No matter how much we try and divorce economic reality from things that we view as critical, like healthcare, it is an economic reality. If I have a hospital, I want to figure out a way to make the product that I offer, which is healthcare, accessible, affordable, and of a high enough quality that people want to come and take advantage of it. So there's no reason to think that healthcare, we look at all the things that have improved drastically since the 1930s. I think I would much rather drive a Ford Mustang, a 2020 Ford Mustang than a Model T. It's a much better vehicle. It's improved dramatically. Somehow we've figured out ways to make that affordable. So we don't know that healthcare would have evolved into this thing that, okay, you have a broken arm, now you're going to have to spend $200,000 for healthcare. That's We don't know what that would look like, but that seems very unlikely. The other thing is obviously we can't just end government involvement in healthcare now. We can't just cut that. I think that when you hear libertarians talk about things and you hear things like taxation is theft and mandates and this should be a voluntary thing and charities should be picking up and taking care of people, not government. You think that okay, if we end this all tomorrow, there's going to be a lot of suffering. There's going to be a lot of pain. There's a lot of people who are dependent on the programs that exist today that would be kind of hung out to dry if we just decided we were going to end those overnight. So, despite the fact that, yes, I am a libertarian, yes, I believe that taxation is theft. Yes, in my dreams, I would love to live in a voluntary society where um, we are not forced to surrender a portion of our productivity to the government. But I understand that right now, realistic solutions have to be put on the table so that we can slowly start to displace government's role in healthcare and start showing the world that a we don't need government to solve these problems. So understand that we can't just end government involvement. We have to take steps to create a greater opportunity and for people to access healthcare. So, what are the things that we need to do? We need to increase availability of health insurance. It needs to be portable, right? We have to increase the portability of your health coverage, and we need to introduce some competition into the marketplace. So, how does that look? The first thing is to increase availability. Availability and portability, these are things that all three of these things are solved through one simultaneous move by allowing more free market competition. And there are things that we're doing wrong. And the first thing we need to do is we need to break the relationship from health insurance and employment. That relationship needs to be broken, but we can't break that relationship by throwing everybody onto a government program. That doesn't solve the problem. It may solve the pre-existing condition problem, but it's going to create so many other issues that the cure is definitely going to be worse than the disease. So we have to look at ways to increase the availability, portability, and the amount of competition in the marketplace. And we're going to talk about how we can do that. And the first step would be to break the relationship between employment and health insurance. We have to break that relationship. Um, so you have these companies that have tax deductibility, um, and they're able to, and you don't pay taxes either on your health premiums. Typically, whatever you're paying in health insurance, you're not paying federal tax on. I think that's great. That's a good start. But I think that the problem here is that the tax break that you get for health insurance is fine, but I also think that you need to be able to buy health insurance a la carte. I think we've heard lots of people talk about this. When we talk about free market solutions, we have to talk about people being able to buy their health insurance a la carte. So the way that health insurance is designed right now is essentially if you're going to sell, and every state kind of has their own set of rules, but if you are going to buy health insurance right now, you essentially don't have a choice in regards to certain coverages are just going to be mandated. Um, Preventative care is mandated. My policy has, through my employer, has treatment for alcoholism. It has mental health and depression treatment, chiropractic care. It has all these different coverages that are kind of mandated that if you're going to offer health insurance, it has to automatically include all of these things. And the best example I can think of to kind of help people understand why this is not a good idea, and look, there's nothing wrong with having all these coverages, but you should be allowed to make those choices. It shouldn't be a mandate, right? Essentially, what this is like is if the state took over the distribution of automobiles, okay? Or not the distribution, that's probably not the right way to do it, but you want to open up a car dealership here in Wisconsin, which is where I'm at, right? I want to open up a car dealership. And the state of Wisconsin comes in and says, look, we love the fact that you're going to come in here. We love the fact that you're going to sell cars in our state. But just keep in mind, if you sell a car in Wisconsin, it has to have heated leather seats. It has to have a Bose audio system. It has to have 20-inch rims. It has to have a sunroof. It has to have self-parking capability. It essentially has to have all of these options have to exist if you want to sell a car in our state. Well, what'll happen is that there's going to be a large swath of people out there who can't afford to buy a car because you've mandated that's loaded up with all these options. Now, maybe I'm a young person who's not making a bunch of money. I'd still want a car, but I want a cheaper car. I don't need all the bells and whistles of this particular vehicle. What I'd like is to buy something, as basic as possible. So if you look, and then because cars are so expensive, and because people at the lower end of the income spectrum now they can't afford it because of all these mandated options, the government's going to come in and say health insurance companies are greedy. They're charging too much for health insurance, and so we have to subsidize this, or we should put everybody on a government program, and we'll just subsidize everybody to go out and buy cars. So essentially, they've come in and they've made it so that low-cost plans essentially aren't available anymore. And then now the fix to that problem is for the government to come in and just buy the plan for everybody, or to put everybody on a government plan. The reason, and as we go through this, the justification for these mandates is always the same. And it's always, well, if we let people choose what coverages they want and what coverages they don't, there's a couple fundamental things that are going to happen. The first thing is people don't know what kind of coverages they're going to need or want in the future. And so they might make a decision that, they regret later. And the second thing is well, if we didn't mandate preventive care and make preventive care free, through these healthcare mandates, then nobody would go in and get their uh, checkups done and so on and so forth. Both of those things are pretty ridiculous. Um, First, let's take a look at the people wouldn't go in and get their checkups. Insurance companies, what first thing the insurance companies would do is say, yes, you're covered. Let's say I wanted to go out and buy a policy and anything over $10,000, right? Anything over $10,000, any expense over 10, I had a $10,000 deductible. Once I have spent $10,000, everything's covered. from prescriptions, but I have nothing else. So I have to spend $10,000 of my own money, and then my health insurance kicks in and covers everything else. That's going to be a very inexpensive insurance plan. Okay. But it's also going to do something else. The insurance company is going to say, yeah, we'll cover any expense over X amount of dollars. We'll do that for you, but you have to go twice a year and get your checkups. You have to do preventative maintenance. You have to do preventative screenings. They're going to mandate that. It's just like a warranty on a car. Okay. If you'd never changed the oil for 20,000 miles, you drive a car with the same oil in it, and then the engine burns up, the warranty is not going to cover that. So insurance companies are going to drive behavior by saying you have to continue to go and get these checkups. But here's the other thing. If people are paying for those things out of their own pocket, those things are going to become cheaper. You're not going to go to the hospital for a checkup if they're going to charge you $300 for you to spend 5 minutes with the doctor. Okay. The fact that we have health insurance paying for so many things that it really shouldn't be paying for, like checkups, for example, has allowed the cost of those things to creep up. Okay. And so as a result, people go, they get a checkup, it's $300. Well, they don't care because they know their insurance is covering it 100%. So healthcare providers aren't being forced to compete on a cost basis. They're essentially, from that perspective, they're allowed to charge as much as they want because it's called the moral hazard of a third party payer. People don't care what things cost generally if they're not paying for it. Again, I'll go back to automobiles, right? If you think about a car dealership that's changing oil, right? If your warranty on your car covered oil changes would be $300. You go into a dealership or a garage and get an oil change, and that's a loss leader for that person. They're losing money by providing that service for you at 35, 45, $50, whatever it costs to go get an oil change. The reason they're offering those things at such a low cost is because when more expensive things go wrong with your car, when your transmission goes out, when you have an engine issue, when you have to spend $3, 4, $5,000 for something on your car, they want you to have some sense of loyalty or some tie to them. So they are trying to get you to come back and get your oil change there on a regular basis to build up customer loyalty. You would see the exact same thing in the healthcare industry. They would lower the cost of preventive care and screenings and maintenance to build up loyalty so that, heaven forbid, but as we all know, as you age and health issues start creeping up, you've got that family doctor or that loyalty to a particular provider so that down the road, as your healthcare expenses increase and you're spending more money on healthcare, they're able to collect that money. And that is when your insurance company would then step in as things got more expensive and help you cover that. By by having everybody's coverage take care of all of their preventive care and having it all go through the employer, you're not paying really for the majority of your health insurance, you're not paying for a large portion of it for a lot of people, and you're not paying for any of your preventive care or your screenings or anything like that. The cost stops becoming an important thing to you, and as a result, cost rises, and as those costs rise, it also pushes up the cost of insurance. Um, the other thing is that we need to, if you could break those mandates and make health insurance more affordable, you could allow health insurance to be sold to larger risk pools. We should absolutely break the attachment of health care to employment, right? And we need to allow health insurance to be sold through anybody, right? Let's take a company like a large insurance carrier, auto insurance carrier, for example, since I'm using cars for every analogy today. So you have an insurance carrier like Allstate or Progressive or Geico, right? They all offer their employees a health insurance plan, but they only have about 25,000 employees. And the way that the health code is written today, maybe half of those employees are choosing to participate in the healthcare. So your risk pool there is of about 12,000. Now, if you look at the number of clients that a place like that has, they may have 5 or 6 million clients, right? So why not where you buy your car insurance, for example, or in the case of Allstate might even be even better because Allstate also offers fiduciary services like investments and life insurance. Why not be able to buy your health insurance in the same way? Now I can buy a much cheaper policy I can sit down with my fiduciary, the person who's helping me make other investments and other decisions. The person who's selling me my car insurance can also sell me health insurance. This person who's helping me set up my investments can also help me buy my health insurance. My local bank where I do business can sell me health insurance, right? So now you're looking at organizations that have 1 million clients, 2 million, 3 million, 4 million. So let's take, Edward Jones has somewhere in the vicinity of 8 million clients. If only 10% of those people said, I'm going to buy my health insurance through Edward Jones, you have a risk pool now of 800,000 people. Well, if you have a larger risk pool, you also have a lower cost because you're spreading the risk of health insurance out amongst more people. So now I have a larger risk pool and I've eliminated a bunch of mandates so I can buy a lower cost policy. Now it kind of benefits me to go ahead and buy that policy. Even if it's going to cost me a little bit more money, I can buy it from another outside of my employer because now I know even if I lose my job or I decide I want to change employers, I could carry my health insurance with me because it's no longer tied to the company. And I think what you would see is a mass exodus from the employer sponsored healthcare to getting your healthcare someplace away from your employer. And this would lead to higher wages because the reason health insurance was offered through business in the first place was because they couldn't pay people more and they wanted to attract workers. In a competitive job market, which is before the virus broke out, obviously we had a very competitive job market here. I mean, you could walk into, close to my house, you could walk into a fast food restaurant and get a starting wage of $12 an hour. So in a competitive environment like that, where these companies are no longer being asked to provide health insurance in order to attract employment or employees, wages you would see a rise in wages. So you would have people with a little bit more money in their pockets. You'd have portable health insurance with larger risk pools. You'd eliminate the mandates, so health insurance becomes cheaper. More people choose to buy it. Like the young person who's 22 and healthy, I put it myself, I am not a young person who's 22 and healthy. I'm a 44-year-old who's healthy, but you have the person who maybe passes on health insurance today just because it's so expensive, who looks at this plan and says, look, I'm not I think my risk for getting sick is pretty low, but just in case, I'll buy this really low cost basic policy that just covers me for catastrophic care in the event of something significant happening. And I'll carry that insurance and I won't carry anything else. You're going to have a lot of people who are choosing to not have health insurance today, who do have access to it, choosing to get on board and buy health insurance. So I believe that plan would obviously we'd have portable health insurance. I think we'd have lower cost health insurance. I think we'd have more people choosing. There are a lot of people in this number of 20 to 30 million uninsured Americans who are simply choosing to not buy health insurance. They have access and they have the means. They're just choosing not to do it. There is a large number of those people. We can't just assume 30 million people don't have access to health insurance. That's not realistic. Some don't. I'm not saying all, but there's definitely, so you have more people participating, you have less people uninsured, you have lower cost insurance that's much more portable. I think that's a good step in the right direction in terms of solving a lot of the problems with our current system, which again is kind of a relic, a remnant of Depression era actions that were taken that really didn't have anything to do with health insurance. There wasn't an outcry for health insurance. Now, the last thing I want to go over quickly is the European style of healthcare and why I know, I shouldn't say I don't think, I know that is not going to be something we can implement in the United States. A couple of reasons here. First and foremost is the European system. The European system is actually a great way to say the federal government shouldn't be involved in healthcare. Why is that? When you look at government sponsored healthcare in these other countries, how is that making a case that the federal government shouldn't be involved in healthcare? It's actually pretty simple. Most of those countries are the size of a large state, right? Sweden has 10 million people. The scale of that operation is nothing compared to what it would take to implement a nationwide healthcare plan here in the United States. Um, it's just from a pure scale perspective, it doesn't make sense. Canada is probably the closest in terms of population. You're talking about a population of what, 30 million people. So you're talking, you got to first look at this thing is from just a scalability perspective. It's just not going to be a functionable thing here. Um, The other thing is outside of Canada, and I haven't really studied the Canadian system as much as I've looked at the European system because it's the European Scandinavian model that we keep hearing about. So when I look at the Scandinavian model, the other thing I look at is the tax burden there. So the top tax rate of at the low end is about 45% to 60% at the higher end. So like Sweden has a top tax rate right around 60%. And I think Germany is right around 45%. Those are their top tax rates. One of the things that Americans don't understand about how their tax system over there works is the United States has a very progressive tax system. So the people at the bottom aren't really paying anything. The people in the middle are paying some, and then as you make more and more money, obviously your tax burden goes up. And I think our top tax rate here is only something like 32%, and that's our top tax rate. The millionaire class, 1% that you hear about, which aren't millionaires, by the way, that's 1% starts somewhere around $350,000 in terms of household income. So this idea that millionaires and billionaires are the 1%, that's garbage. But nonetheless, as a middle class person, you make $150,000 a year. Married couple of kids, both of you makes, a decent wage of 50, 60, $70,000 a year, which is a very good wage. It puts you kind of right in the middle of the middle class, maybe at the higher end, upper middle class. Um, you're probably only paying about 25%, and that's even before your deduction. So we have a very low income tax burden in the United States when you compare it with other places. Okay, so you have to ask yourself, what would happen if the top tax rate started applying? The idea is that only millionaires or people who make over $10 million are going to pay these ridiculously high taxes of, 45, 50, 60% of their income. That's not how it works there. Their 60% tax rate, excuse me, the 60% tax rate in Sweden, for example, would apply to an income that would be equivalent to about $60,000 in the United States. So if you make a $60,000 income in the United States, $60,000 income like in Sweden, you're paying 50 to 60% of that in taxes. So when you look at their disposable income, their buying power, what they're able to do with their income, yeah, okay, great. I'm not paying for healthcare anymore, but I am paying for it. The tax rate is astronomically high. Then you have to look at the way that Americans live is very different than the way that Europeans live, particularly in the Scandinavian countries. It's a denser population, smaller population, city-centric kind of a lifestyle. The United States is not necessarily that way. We are broad spread out. We of course have our major cities, but I live in a rural community. Most of us live in suburbs. We live outside of the city. We're not city centric. We live in homes that are 2,000, 2,500 square feet. We have a couple of cars. Yes, and that's the majority of America. The majority of America is not poor. The majority of America lives in that middle class realm, right? So what would a 45, 50, 60% tax on the American people, what would that do to our economy? It would collapse it overnight if we had to take on the burden of that expense. And what you would say is, well, we're not going to raise taxes like that. A tax increase like that would never happen. Well, then you're just going to have to print that money, and therefore you're going to have an inflationary crisis where things are getting incredibly more expensive incredibly quickly. So from a financial perspective, it's not going to work. From a scalability perspective, it's not going to work. And I think as we move through the crisis we're facing right now with the coronavirus, you're going to see that centralization is not great. You want small pockets. You want small independent pockets of healthcare providers, of administration, so that a failure in one is just, you look at this as the same way we looked at the economic crisis in 2008. We want this thing diffused. You want decentralization so that a failure in one place doesn't threaten the entire system. So centralizing healthcare, adding that massive burden of either huge inflation or huge tax increases, it's never going to happen. And the Democrats know, the people who are proposing this stuff, they know it's never going to happen. And the Republicans really aren't proposing anything. And the reason for that is both of these parties are largely funded through big pharma. They're funded through insurance companies. Insurance companies don't want this. They don't want to have to get out there in the open market and compete and be creative and offer different types of solutions for people. This is perfect. I walk into an employer, I don't have a choice between Aetna and Blue Cross Blue Shield and all these different big health insurance providers. This is the provider my company goes with. They don't have to worry about competition. It's a captive audience. So there is no competition. The mandates are already there. They're collecting the money. Why would they want to rock the boat and have to go out into the world and actually compete against these other agencies and have people be able to shop from one to another and compare all these different healthcare plans, as opposed to, okay, I'm captive to this healthcare provider. So, when you look at Big Pharma doesn't want to, hey, this is perfect. The health insurance companies collect all this money. We can charge whatever we want because by and large, the third party payer system is perfect. The consumer's not, you hear some outrage about this thing went up and got more expensive and there's massive inflation in this particular area of healthcare. But for the most part, there's not a huge uprising about it because most people have insurance coverage. So I can charge whatever I want for the item because the insurance company is going to pay for it and the consumer therefore doesn't care what it costs. So they don't want to rock that boat. The health insurance companies don't want to rock that boat. It's all going great for them. And that's why from the Democrats, you're getting solutions that are never going to happen. And from the Republicans, you're getting virtually nothing. That's why the system is the way it is. But if we really want to break through to it or break through the system and really start looking at ways that we can actually improve healthcare in the United States, we have to get back to a point where consumers are actually paying for more of their own health care so that that cost value equation is always there and people are actually thinking about what they're paying and thinking about the quality of the care they're getting and understand what the pricing actually is. That's important. And we also have to make health insurance companies compete with each other in the open market. And we have to create a scenario where people can take their health insurance with them. And so, in order to do those things, we have to break the standard right now that all of our health insurance is tied to our employment. If we can move in that direction, then we can really start working to solve healthcare. And I think many of the problems that we're facing right now will become much, much smaller and therefore much more manageable. So that is kind of my brief on healthcare. I hope you enjoyed it. Thanks for sticking with me. This will be up on the YouTube channel. I am Brian for Liberty everywhere. I'm Brian for Liberty on TikTok. I'm Brian for Liberty on Instagram. I'm Brian for Liberty on YouTube. And this is the Brian for Liberty podcast. And I will look forward to speaking with you folks again next week because we talked about taxation today and force and libertarianism. Next week, we are going to talk about the income tax itself, its history. How did we end up with an income tax? Has this always just been a part of American life, or is this something that we were actually able to do without for a long, long time? How can we walk away from it? Why it's terrible and horrible, and if we could eliminate the income tax tomorrow, the world would be a much better place. So I hope you will come back next Saturday for my breakdown of the income tax, and I hope you enjoyed what you heard today. If you did, please share it, and thanks again.